We all find ourselves in this position at some time or another in our life when our parents get older and we become the caretakers of them. The roles reverse. It gets tougher and tougher as they get older, of course, and as our lives get busier. So the Director of Business Development, Jane Teasdale, is here, and she's also co-owner of Mosaic Home Care Services. And we also have the Managing Director of Elder Care Inc., Audrey Miller, to talk about some of the challenges that people are facing and some great solutions to help them through it. We're known more and more as the sandwich generation because some of us are older parents, so we have younger kids, and yet our parents are aging, so we're literally stuck in the middle taking care of two dependent groups. So we know that as people get older, their quality of life often diminishes. What's it like for them in the last 10, 15 years?
Well, one thing is people are living longer, so you know, we need to have places for individuals to go, community centers. Families need to know where to tap in for services, and cost-effective programs that are out there. Not everybody can afford having private home care coming in or paying for retirement homes that are anywhere from $3,500 up to $8,000 or $9,000. So really families have to look
a month.
at,
A month, yeah. So what we know from research is that for the last 10 years of life, most of us have it in poor health. And money doesn't stretch as far as it really needs to. And so there's tremendous demands.
No, that's right. My financial advisor told me I need to die by 80.
Yes.
Sad comment, you know. And unfortunately, dementia is a major issue that we're dealing with. The oldest population, the fastest growing, are 85 plus. And 1 in 3 will develop a dementia in that grouping. And as you know, it's a progressive disease, so it requires a lot of care, and care can be expensive. And many people are reliant on the public system, and that's where private home care comes in and care navigation comes in, so your money can go as far as it possibly can.
Because some people start with CCAC first to see what they can get from the public funded services. And you know, they're really providing the personal care. And then sometimes families are needing additional services, such as, you know, meal preparation, light housekeeping, laundry, companionship. So that's where a lot of the private home care companies come in, that they can certainly help families.
Yes. And what does Mosaic Home Care Services do?
So we provide many different services under our umbrella. We have our second location now, which is at CNIB Centre, Canadian National Institute for the Blind, so in the community. Our other office is at Steeles and Daw Mills. So in both locations, we provide a resource center of about 250 different pieces of literature and information. So again, we are just a link to other organizations, because families that are coming in, they may not needing just home care services. They want to find out more about community care access, or Meals on Wheels, or Lifeline, or what retirement homes, or information about long-term care.
And just wouldn't know where to start looking.
So we're just a link for that. And then we have wonderful educational events. Last week we had the Royal Ontario Museum coming in talking about fashion. And then in April we're taking some seniors to the ROM. Mosaic is paying for that, as well as Amica at Bayview. And so we're doing a whole education and lunch component. So again, you know, we're providing home care services, additional care. We deal with people with Alzheimer's, dementia, overnight, 24-hour care. We've started with a lifestyle component, so we're really figuring out what that individual needs and what their families are. And we spend, you know, a lot of information detail on that. You know, what did that person do when they were younger? What kind of hobbies would they like? It's not just about providing home care services and filling shifts. We really need to find out. So we spend a lot of time educating the personal support workers and those people that are going in to help that client.
That's wonderful to hear, because these are people who in the prime of their lives were like us.
That's
they were out and about doing things, having hobbies, having a job, raising their children, and they must feel like they're not real people anymore, or at least that's the way they're being treated.
Well, and it's about dignity and respect. And ensuring that you're living as well as you possibly can. So, you know, certainly that's a way that we help to ensure that the senior's living as well as they can and reduce the stress on the caregiver.
Love that. So how does Elder Caring come into play, Elder Caring Inc.?
So we're a geriatric care management company. I'm a registered social worker. and I have a team of social workers and occupational therapists. And we provide a step-by-step action plan for families. We assess the individual to ensure that they're living as well as they possibly can. And by providing the support and expertise, we're trying to reduce some of the heavy burden that caregiving can bring. Employed carers are a huge group. 28% of Canadians, our recent Stats Can tells us, are providing care. And the most recent report tells us that it's about 9 hours a week that an employed carer, and you know how many hours you're working a week, it's a lot of time and very hard for families to navigate the system. So we support the public sector, absolutely, and then help navigate and access what we can, private resources to always supplement what people can get privately, and advocate and ensure that their loved one is doing as well as they can.
Just knowing that there's help out there is probably a relief for some people to hear. You've also joined forces.
Yes.
This is called the Elder Caring Plus service. What is that?
I'm gonna
Okay.
let Audrey.
Well,
'cause
there's two components here, and home care is very, very important to ensure that the senior is staying at home. Most people want to age at home, right? I do, you likely do as well. And geriatric care management is now integrated into the home care sector. So we used to see that in the public sector and really don't see it that much anymore. And this is the first to be able to offer it within a private resource. So for example, we're dealing with a family, and it's a senior in his 90s, and his children live in different cities. He got the flu, came back, was completely independent before the flu, and now requires 24-hour care as he's trying to recover. And without having any family to support him, there are a ton of details. So it's the oversight service being able to connect with the personal support worker or PSW on a daily basis to be able to anticipate and access services before there's a crisis. And that's really key to ensure that we're planning ahead and helping families know that.
How would this have all started for him? Would he have been in the hospital with the flu and then got hooked up that way, or how would that have come together for him?
Well, that's exactly right. So went into the flu, and in fact his neighbor was dealing with Mosaic and knew what a wonderful job. And that's really how we came together.
Yep.
I mean, elder caring's going on to 11 years, and I've worked with lots of home health care companies. And Mosaic's really always been very professional and very reliable and very well-trained staff and responsive, right? That's what I need to have, is responsiveness. So I can get an answer quickly, and it's very difficult. So we came together with that.
So that's how that starts. So they first started with the home care services, and then our RN goes in and does the assessments and talks about Elder Caring Plus. So if the families want that additional service, they're able to get that.
The turnaround is quick. We've
That's
got about
right.
30 seconds left. So
Okay.
there's a presentation coming up in May where people
yes.
can learn.
Yes.
Tell me quickly what that's about.
It's on May the 21st, and it's featuring Audrey and Caring for Our Parents today and tomorrow. And it's being, we're organizing it at the Verity Club, Ladies Club downtown on Queen Street, which is an old, from the, historical building, which was a candy factory. And so Mosaic will be providing dinner, and so it should be.
And it's a free event.
Yes,
Yeah,
it's a free
open to the
event, so we're
public.
sponsoring it.
So sign
And
up.
wonderful education,
So
for families to know about, certainly.
if you or someone you know is dealing with aging parents, get in on that. Go to mosaichomecare.com for all the details. Also, eldercaring.ca. Thank you both so much. We're glad you're out there for us.